to Pet's Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Tuesday morning on Kildare's KFM on the 11 to 3. Des Groom from Gym Dog joins us for A Pet's Life to discuss all your pet-related questions and some. Now, I'm just saying to the listeners, he's very giddy today. He's very, very giddy. I'm going to watch you today, Des Groom. Do you know that?
Too much coffee, is it?
I don't know what it is, but there's something I miss. Is it your midterm or something? Oh, tell you listeners, we're in for a treat today. Don't forget, any questions you have for Des, we'd love to hear from you. You can get in touch by sending your WhatsApp text voice notes 0833 97 97 97. Now, Des, before we look at any of the other questions, I got instructions you wanted to discuss pets and parasites foremost.
Yeah, okay. So the main reason for that is I want to let you know, Dave, that my practice, Kildare Vet Surgery, is the first place in Ireland to have a new machine called an Ovacyte to offer to our patients, right?
Yeah.
And an Ovacyte is a pet parasite testing machine using AI, right? Yeah, AI, if you don't mind. Mm-hmm.
Wow.
Yeah. So here, the whole thing about this is, right, there's a couple of issues with regards to parasites. You know there are two types of parasites.
I do now.
Yeah, right, okay.
Okay.
So you have the wriggly ones. They're internal parasites, the wormy ones, obviously. Everybody knows about worms. Dogs and cats get worms. People can get worms. And then you get the creepy, crawly, hoppy ones, the skin parasites. So basically that means internal parasites, external parasites. And nowadays we have treatments that do both. And you can get these combo treatments are the commonest that do both. Do worms, right, in terms of treating and preventing them, and also treat and prevent fleas and ticks. And strictly speaking, the public health guidelines that I bang on about here week after week, right, is that parasites, pets should be treated for parasites monthly.
Monthly?
Yeah, monthly. House dogs that are indoors.
Okay.
See, that's the whole thing about that. Because of the human health risk, we are recommending monthly treatments.
Okay, that's for pets. So now you mentioned there that humans can get these parasites as well.
Yeah,
so
this is the whole reason why you should treat your pet monthly, is because of the human health risk.
just jumping ahead then.
Yeah.
So a human contacts a parasite. Is it a big, nasty procedure to rid them of it, or what's the story?
No, like, okay, probably human adults that have a dog are not really likely to catch worms from that dog. No, but children and immunosuppressed individuals would be at risk.
Gotcha. Okay.
There was a study done by the zoology department in Trinity College University last month, and it went all over the media because it was picked up from one of the journals of tropical medicine. They did soil analysis of the 12 municipal parks in Dublin, and 9 of the 12 parks had evidence in the soil of roundworms.
Wow.
Yeah, and roundworms that had come from dog faeces that are directly transmissible to people, children in particular. And what was a bit disgusting about it was, right, there's a soil analysis were taken from the playgrounds in the parks. And that's where they found the roundworms. So people walking their dogs, right? So it tells you two things. First of all, people aren't picking up after their dogs properly. Number one.
Oh, yeah, well, that's bad now.
That's bad now. And number two, probably the rate of treatment for parasites is not high enough. Most of the dogs in and around the park not adequately dewormed, that they still have roundworm eggs in their stools. Yeah. So vets will be pushing for this, pushing for monthly treatments. And of course, there's two types of dog out there. There's the one that's adequately dewormed and vaccinated, and the one that's not. And 50% of the dogs out there are probably very religiously treated. And I suspect half the dogs in the country are hardly ever dewormed. Yeah. So, now, that prompted me, something I've been thinking about for a while, something that's been an issue, because people ask us, how do I know my dog has worms, right? Well, now, with the help of AI and computer medicine, computer science and everything else, now there's a simple, handy in-house testing device to analyse a little portion of dog faeces, and we can tell the owner whether there are any traces of parasites, traces of worms there or not. So we can prove to you if your dog needs to be dewormed or not.
So your practice is the first in Ireland that has this machine?
Yeah, it's something I was into. I wanted to do it because, as I say, I see the need there.
Well, congratulations, Des.
There's another reason why, as I say, we're ahead of the curve on this and why it's important, is because, you see, if we do get the rate of treatment up and you have more and more animals living indoors with people, and more animals are getting treated, and we move on into that modern lifestyle of pets being more and more humanised, more and more domesticated, you're going to run into problems with, then, right, one problem will lead to another. You'll have resistance to the dewormers, resistance to the medications. That's the first thing. And the second thing that will happen over time, it's already happening in some of the more densely populated cities in the world. You have environmental damage. You have water contamination due to medications like dog medicines, animal medicines, going into the water. So I forecast that over time, people are going to be more aware of the need to deworm and treat and medicate their animals selectively.
So you reckon, Des, sorry to interrupt now, you reckon once a month to deworm?
I do if you have a house dog.
And what about humans?
Couple of times a year if you're a human living alongside your dog.
Okay, I just want to go back to my question. So say I contact one of the parasites. Do I have to go to hospital, or what's the cure for it? Or
No, simple over-the-counter medication from any chemist.
Oh, super, okay.
Yeah,
okay.
Little bottle of stuff, yeah.
Okay, oh, that's good. Now, what about, did you say indoor pets can get parasites as well?
Well, you see, they're never just indoors, to be fair. Right? So they do get out for walks and they go to parks. And even if you're just keeping your little housebound chihuahua to a little toilet break in the park, well, that's the one place where he's going to come into contact with the byproducts of other animals.
Gotcha, okay. Can I move on to something, Des? Because we had a text in earlier from LK, where was it? Laura Kelly. And she was talking, she says, could you ask Des about fox poo? Now, I never thought I'd be talking about poo on the programme. But apparently it can be dangerous. Or what is the story with fox poo?
It's smelly and awful and horrible. And domestic dogs seem to love to roll in it. And they can pick up, obviously, all these parasites from foxes, because foxes carry every type of parasite. And moreover, wherever you find fox poo, the foxes have been probably lying, the foxes have been there. It's also a location where dogs will pick up mange, which is a skin disease, and they'll get that from contact with foxes.
That's nasty now.
Horrible, yeah.
Now, good morning, Des and Dave. What do I do if my dog eats one of the Easter eggs? Kira. Kira wants to know the answer to that.
Milk chocolate is relatively low risk. It'll cause diarrhoea, it'll cause nausea, it'll cause vomiting, but those signs will be transient. But high cocoa chocolate, the dark chocolate, is more dangerous. So chocolate that contains 50, 60, 70%, that sort of high ratio of cocoa, is dangerous, and a small amount of it can be harmful, toxic to the liver of a very small dog. But these toxins, these poisons, are very much dose dependent. So a big dog will get away with a little bit of indiscretion, whereas a small dog wouldn't. But if your dog, perchance, ate lots of it, you should visit the vet. And what they'll do is they'll give the dog an injection to make him vomit it back up. And if his vital signs are abnormal in any way, they'll put him on a drip then, maybe for half a day or so.
Isn't it ironic, Des, that how we are told to eat the darker chocolate, the richer chocolate?
Yeah.
And how that's the one that damages the animals more so than the milk chocolate.
Dogs just have this enzyme in their liver. They don't cope with theobromine, which is the ingredient of the dark chocolate.
The scientific ingredient.
Yeah, it is. It's a scientific ingredient that we like, the theobromine, because it's actually addictive. And that's animal dogs' livers in particular. Their livers can't process that.
Break it down, right.
Yeah.
Richard in Newlands Cross, happy Tuesday, Richard, says, good morning, lads, Dave and Des. My query concerns our dog, Lily, a lab cross. She dribbles, drooling a lot, only occasionally. But I'm just wondering, do I need to take her to the vet? Thanks, great show as usual, Richard, Newlands Cross.
Yes, do have her checked out, Richard. Lily just needs to have her teeth looked at. Sometimes excessive drooling like that can be an indicator of dental disease, can be an indicator of toothache or discomfort in the mouth, in and around the mouth. So, yeah, a vet should have a good look inside and see what's going on.
Now, we've one from Fiona Kelly who says, my dog is constantly eating grass. Is she sickening for something?
Yeah, okay, so that's an indicator that she needs more roughage in her diet, actually. That's all it is. Dogs self-medicate. They eat grass to self-medicate. She wants to bulk. So it can be an indicator of a little bit of heartburn or a little bit of nausea, and they'll eat grass in order to bulk up their stomach contents a little, make themselves feel better, relieve the nausea. So maybe have a chat with your vets about that, about what can be done, and examine her diet. It's often an indicator that she needs a higher level of fibre in her diet.
Thank you for that. Please ask Des, what is a healthy weight for my cat? And that is from Marie O'Sullivan.
Healthy weight for a female cat is generally 3 to 4 kg. Healthy weight for a male cat could be anything from 4.5 kilos to 6 kilos. Now, cats that get to 7 to 8 kg, whether they're male or female, that's overweight.
Right, okay.
Yeah.
Brendan was on to us to say, Des, my dog has a bright red spot on the lower lip, and basically I'd say Brendan wants to know what's going on there.
That looks like an ulcer. I don't like the look of that. I would let your local vet have a look at that. There might be it could be very simple now. Maybe a simple cream, anti-inflammatory cream might be all that's needed. But that's a little ulcerated lesion there on the lip. It could be anything. It could be an abrasion or a cut. It could be an infection, or it could be an allergic reaction to something.
Keep your questions coming in to us here on our special Pets Live spot with Des from Jim Dog. 0833 97 97 97. How do I stop my dog jumping up at visitors? She's not aggressive, just overexcited. That's all. Okay, so something we talked about Cesar Millan here actually last week, the famous dog trainer from the US who we changed the way we think about animals really in many ways. And he came up with the concept of calm, assertive leadership, right? That your relationship with your dog shouldn't be like a parent to a child, or it shouldn't be like just a friend, right? That you have to actually use your leadership skills on your dog. So the very best way to relate to your dog is in a manner of calm, assertive leadership. And another way I describe that is that dogs only understand binary communication. So good dog versus bad dog. Keep it simple. They don't understand conversations. You can't debate with them. There's no emotional persuasion involved, right? So that's relevant to the dogs that's jumping up on visitors, because what you need to do there's no point in punishing the dog after the event. They don't understand. You have to catch them in the act and you have to go, no, down, out. No animals
Did
were
that scare
hurt
you? Did that give you a fright? You say, no, out. And there's just a sudden sharp shock. And the way they learn to behave appropriately, they moderate their behaviour based on the response they get. And they're social creatures, remember, and they want to be in the thick of things. So if they're behaving in a way that results in them being put out, put to bed, put in the utility room, put back in their crate, after a while they will learn not to do that behaviour.
That's super. I'd say there's a lot of people saying, aha, and then that'll do the business.
No, out.
What shots do kittens need, Des?
Yeah, they need 2 shots between 6 weeks and 12 weeks, 2 to 3 weeks apart. They have to be done for 3 types of cat flu. And I do recommend, if they're going to be outdoor cats and hunting, they also should be done for feline leukemia. So there's 3 types of cat flu, and there's feline leukemia, and it's 2 injections that can be given 3 weeks apart.
Sorry, I just had a text in that says, thanks, Des, my dog just ran out of the house.
Out the back door.
Oh, I knew he was trouble.
That's terrible. That's terrible.
My dog has a dreadful wind problem. Can I add something to her diet to help? And that's Mike B.
Yes, and you probably need to take something out of her diet as well. I'd like to know what she's being fed, okay? Do you know what? Grain-free diets. Grain-free can be good for that. So excessive bloating, excessive carbohydrate, excessive cereals and grains can contribute to too much wind like that in the dog. Okay, Smelly? So a grain-free diet can be helpful. I'll tell you what, if you want to come and see us in Jim Dog, or have a look on at petslife.ie, we can give you all the advice you need about a suitable low-carbohydrate, grain-free diet.
My dog hates to be groomed and tries to bite the brush. How can I help her not to be scared of grooming?
Bring her to a professional groomer. Leave her there for the morning. Let the professional groomer tell you how she got on. Usually, these people who groom for a living, they're very, very good at managing little dogs and getting them used to the process. And they might say to you, she was a bit tricky, but we got round her eventually. You get the odd dog, maybe 1 in 100, where the groomers will give up and they'll say, this one needs a sedative, I can't manage her. And if that's the case, that can happen if you've left it too late. So if you have a dog and she's scraggly and she needs grooming now and she's over a year old and no one has ever got a brush near her for the last year, in that case it can be too late. And the groomer's going to say, here, listen, I can't get near her, I can't manage her, she's too stressed, she's too difficult. Even with a muzzle, she needs a sedative. That can happen about 1 in 100. But usually you start them young enough, and these girls are very, very good and very patient and at putting the time in and getting around the dog. And they improve over time. So leave it to the professionals. If you're struggling and don't give up, go to a professional and have it done properly.
Very good. Des, we're coming near the end now. Is there anything else that you wanted to include further in relation to the pets and parasites?
The Ovacyte Pet Parasite testing device. It's something now we're going to start offering our clients, our pet owners, as a choice. Do you think your dog needs a dewormer? When was your dog last wormed? Would you like us to test and see, does your dog have worms? So if we get to the stage where we're in that type of a push-pull situation where we're giving public health advice to do the treatments monthly. But I know well that over time people are going to start saying, listen, we want to be a bit more selective, we want to be a bit more discerning. So we can offer testing to dog and cat owners who, out of curiosity, want to know, does their pet have worms before they give the treatment.
Fantastic. Well, Des, I want to take this opportunity from all of us in here, from the listeners, to wish you and all the gang, the fabulous group at Jim Dog, a very happy Easter.
Thanks, Dave.
And don't eat too many Easter eggs.
No, I won't eat too many Easter eggs. And I'll bring your lovely, your kind gift of donuts back to the team in Jim Dog. They'll be delighted. And I'll try not to eat them on the way home.
Yeah, so that's what happened. Yeah. Thanks, Des.
It's a pet's life with Jim Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.